Not so much of a tear trough issue, but what we saw on Eve was a little bit of submalar hollow, a little bit of midfacial submalar atrophy and wasting here that kind of gives the appearance of a malar bag here, but it's not necessarily a malar bag, it's really a depression that's in this area. And speaking with Eve, she says this is kind of a family feature. A little bit of shadowing in the nasolabial fold and a little bit of shadowing here in the marionette line. So we're going to choose the Revanese as well and do some small little subcutaneous injections in this area, and this area. And I'll try again with the small 30 gauge needle. It's a smaller needle, less painful, less likely to have bruising and whatnot. You have a little bit wider range of options with the type of injectable you can use. Just a little bit of alcohol, so just keep your eyes closed, okay? Meaning that the gels that are meant for deeper injections, the gels that are more cross-linked, for example, in this family of products, it would be the Revanese Ultra. The ones that are more cross-linked and that are a little bit thicker, you can use in these areas, especially the nasolabial fold. And if I flick on the skin like this gently, she's just less likely to feel the needle go in. And if you can see me tenting up here, I would consider this kind of a subcutaneous fat location of the needle. And just making short little fanning passes. I think this is an area where I could easily use one of the blunt tip cannulas as well. I like to try and avoid boluses and try to use a pattern that's like fanning. All right, so while I'm holding pressure here, I can mimic and see where her nasolabial fold is, and just little flicks here, and inject, retrograde, retrograde. Sometimes I'll inject in the nasolabial fold in that subcutaneous space, and you reach that point where you get minimal returns, where you're injecting and you're not seeing the tissue fill as much as you'd like. That's the point where I like to go down more of a pre-periosteal injection deeper to inflate and build up from the deeper portions of the face. Well, we have a nice correction here. There's a nice improvement in this area as well, so she'll have less of that submalar hollow. And then the last place we're going to go is just going to be right here in the corner of the mouth, okay? That once you're treating the marionette line, if you have a little extra injectable gel, it's nice to treat this area as well. But this little bit of shadowing here that we're going to get, again, just kind of a flick of the skin, tenting up the tissue here. I like to try and get all the way to the lateral oral commissure. Let your lips separate just a little bit, thank you. And I'm looking at the corner of the mouth. The corner of the mouth starts to turn up. That tells you that you're in the right space and doing the right amount. Just removing the needle real slow, less likely to get blood here. This is an area where I often spend a little bit of time massaging, and sometimes I'm going to put one finger inside your mouth, okay? Let your lips separate, yeah. And so just to get a nice bit of massage on that area, make sure that I don't have any lumps and bumps. And you can look, oftentimes the lateral oral commissure will go from a negative vector like this to neutral or slightly turned up. And at that point, I know that I've got a nice correction. And tilt your chin down just a little bit for me. Okay. Doesn't need much here, but there's just this little depression that she has that, again, with a little bit of fill, a little bit of gel. So doesn't need a whole lot, but just a little bit. If I need to see, again, I can just push like that a little bit, see the shadow of where I want to go, and just flick. Try to introduce the needle, bring it up to the oral commissure right there. Less shadow in the nasolabial fold here. This shadow that she had between in the submalar area is nicely corrected. If you look at the corner of her mouth, instead of a downward turning oral commissure, her oral commissure is now kind of parallel to the earth. Less shadowing here. Turn your head just a little bit, yeah, and then turn it the other way. She made my job easy because she didn't need a whole lot to begin with, but it's a nice, soft, gentle correction nevertheless.